Well, I appreciate everyone coming out, some familiar faces once again. Good to see you all. My name is Dr. Tim Dunne. We have a clinic called Advocate Integrated Medicine over in Johnson City. And we came up with the name because it's important to us that the patients come first. And we are your advocate, especially in times like now. One of my challenges is that it's my responsibility or your doctor's responsibility to process the information that's being given, break it down, see the accuracy of the information, and then apply it to your individual case. I don't believe that's being done in today's healthcare system. So that's why we started our particular facility, because we advocate for the patient. In other words, I'm not married to Blue Cross, I'm not married to Medicare, I'm married to our patients. You come first, you're our priority. And that's how we got started. My background is that I'm married to Dr. Cindy Dunne. We're both chiropractors by initial training. Then I did a residency in rehab, functional medicine, and then I did another residency in sports medicine. We worked for 9 years up in Toledo, Ohio in an integrated facility with 35 other medical doctors. What I liked about it is that the patient comes first. In other words, when patients came in, each one of us would assess the patient. And then we all sat in a round table and gave our input into how the patient was going to be treated. That to me is integrated medicine. And that's what we do at our facility. Every new patient first goes in and sees our medical team, Dr. Holly or Dr. Riggins. From that point, then we order our diagnostics, and they are functional diagnostics. So when we talk about that word functional, I want to touch on that only because you folks have brought that up. If you look up the word health, how many of us want to be healthy? All of us, right?
Yep.
All of us want to be healthy. So when I first got out of school, I went to a hospital with a clipboard, and I wanted to know how many professionals knew what the definition of health was. Yes, I interviewed 100 medical doctors and nurses. Health is defined as functioning at or near 100% and not merely the absence of disease or infirmity. So the word function is how you work, not how you feel. Make sense? Here's the next critical piece of information. Your body will attempt to adapt to all of the different circumstances that you're putting it under until it reaches a threshold of 60%. Meaning, if you keep giving it things that it can't handle and it keeps getting worse, once it reaches that 60% threshold, then it will tell you you have a problem. And how does your body tell you that it has a problem?
Pain.
Which is a symptom, right? Mm-hmm. Because isn't high blood pressure a symptom?
Yes.
Isn't elevated A1C a symptom? Isn't obesity a symptom? Your body won't give you a symptom until it's up to here with your shenanigans. In other words, you keep putting your body through all these different scenarios and it can't overcome it anymore. And once it crosses that 60% threshold, it gives you a symptom. Being that I'm a nervous system doctor, otherwise known as a chiropractor, the weight of a dime is 2.2 grams. Why is that important? There was a study out of the University of Colorado that states that 2.2 grams of pressure applied to a nerve will reduce the conduction of that nerve by up to 60%. Why is that important? We all know what paralysis is, right? Paralysis is 100% loss of nerve flow. 100%. And I just stated that the weight of a dime will cause up to 60% loss of nerve flow. So what's that called? Well, it's partial paralysis, right? Otherwise known as chronic disease. I learned that in my second year of college, and that's what made me become a chiropractor and not an MD. Do you know that your medical doctors take 3 national boards? I took 4. Their first 2 and my first 2, I sat right next to each other. We take the same exams. The difference is the third exam, they take pharmacology and surgical. I take things like nutrition and chiropractic and x-ray and all those other things. It's not till the third exam that we start to go down different paths. Information that you need to know. So today, our topic is going to be more of physical medicine, more of joint health, but doesn't that apply to every type of health? Yes. So there's tests that you may be very familiar with that are functional in origin that you never thought were functional. How many are familiar with a stress test? Everybody, especially at our age, right? A stress test, you can either get an injection, but the more common type is on a treadmill, right? You get walking on a treadmill, we're going to raise it up, and we're going to see how your what reacts, how your heart reacts to the stress, and then that tells me how it is functioning, right? Well, if that's the case, you're going to load a tissue under a stress, see how it reacts to that load, and then that tells you what the problem is and what you need to do to resolve it, right? Why aren't we doing that in medicine across the board? And that's exactly what you described to me. That's functional medicine. You're going to stress a tissue, see how it reacts, and then that, in fact, tells you what to do. If you think you're having gallbladder issues, let's go down and get some hot peppers. We're going to go pretty darn quick, aren't we? It makes sense, right? And this is what functional medicine is. We're not using chemicals, we're using things in nature. So one of the topics I'm going to get into is x-rays. Can x-rays be a functional test? What do you think? Yes. How would I x-ray a joint under a load? Any thoughts?
Long way.
I'm standing, right?
Right.
So if I want to know what my knees, my hips, or my spine is doing, shouldn't I x-ray when I'm standing up? And wouldn't that tell me a lot more information?
Yes.
Yes. Because if my back is killing me, and I lay myself down and then take an x-ray, typically the pain's gone when you lay down, right? Is that when you want the diagnostic? No, you want the diagnostic when it hurts like the dickens, right? You want to load it in a way that makes it fire up. Because now I get to see how that tissue is reacting under a load. That, in my terminology, is called a functional diagnostic. We have an ultrasound in our office. We work on a lot of athletes. So if I have an athlete that we think has a bicep tear, or we think has a rotator tear, we can do an ultrasound of that tissue, and then I'm going to put a 20-pound weight in their hand. You're loading it, and now you do another ultrasound. Did the tissue change under a load? If it did, ding, 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 chicken dinner. There's your answer. This is functional medicine. You ask the body what it needs, and it will talk to you, right? We don't have to be doing high-dollar tests, but we have to know how to speak the language. You and I can converse in English all day long, but if you want to speak Russian, you may be able to speak Russian, sir, not this guy, right? We've lost the ability to communicate with our bodies. So one of the other major aspects about our facility is that I want to empower you to know your body so that you start becoming the decision maker on your health. Wow, that's kind of random, right?
Shocking.
It's your body, it's your health, it's your life. You should make the decisions.
Exactly.
Doesn't that make sense? Yes. But my job should be to empower you, to lift you up, and to educate you so that you have all of the information in front of you, and then you and your spouse can make those decisions that best fit you. Wow. Why is that such a novelty? It's called freedom.
It takes a lot of time and effort on the medical team to arrive at that. And time is something in our medical system that is not available.
You're exactly right, because it's not a priority.
Right.
The priority is, ma'am, I've run these diagnostics. I don't even do this anymore with patients.
It's kind of like the money thing. It's
Yes.
all about money.
Yes, and that's one of the things that we do when you come in our office. We hug a lot. I want to get up close to you. I want to see the colors of your eyes. I want to see the quality of your skin. Because it tells me something.
Your skin's the mirror.
Your skin, yes, it's your largest organ,
It's
right?
the mirror of the body.
Everything is telling you something if you speak the language. So learn the art of speaking the language. And that's what we do that's so different. I want to empower you. I want to teach you. I want to educate you with everything that I can so that you make a better decision about your quality of life. You'd be surprised at how many people, they say they want to be healthy, but then that requires work. And they're like, I'm good where I'm at. Okay. As long as it's your choice. As long as it's your choice, ma'am, I'm fine with it. So that's why we do seminars. That's why we do educational things. We do something called a report of findings, where your first day you see our medical team, we order diagnostics, we do diagnostics. Whether it's labs, x-rays, ultrasounds, whatever's needed. Then our entire medical staff, we sit down and we go through your chart. Miss Tracy back there is our exercise tech. She'll say, I think we need to stabilize this and we need to do that. Dr. Holly would say we may need some trigger point injections in these different muscles. Our chiropractors say we've got to reestablish balance and symmetry within the spine. If we don't do that, her job is in vain. Okay, so then we put together what needs to be done, and then it's my job. I sit down with you and I review everything that we've gone over as a team and our recommendations and why. I explain your x-rays. We sit in my office with a TV almost that size, and we take your x-rays from that big and we blow them up to that big. And we're going to explain your x-rays. And then if you want a copy of them, we're going to burn a disc right there and hand it to you. Or if you want to take your cell phone and take pictures. It's your information. It's a different way of doing healthcare. What's the definition of insanity? Doing the same thing you've always done over and over and over and expecting a different result. How's that working for you? My favorite saying, and I say it to myself over and over every day. All right, Tim, how's that working for you? In other words, is what my actions, is it giving me the results I want? Because if my actions aren't giving me the results I want, then I better change my actions, right? Isn't that applicable in healthcare? Yes. If you are empowered, right? That's Mr. Lyle. If you are empowered, and if you are educated, here's the key, with all of your options. How many classes are taught in med school on nutrition?
Very little.
0. How many classes are taught on health?
0.
Yet, when you're a patient and you go into your doctor's office, what are the things that you want? You want to be healthy. Well, if you want to be healthy, let me have you visualize. If you would, Choi, we need to create this slide. A pyramid. On the bottom of the pyramid are things that are less important to you or your body. And the things on top of the pyramid are the things that are the most important. I want you to visualize that. And now I want you to visualize January 1st. What do we call January 1st? Obviously the first day of the year. But from a health standpoint.
Resolutions.
Resolutions. How is that working for us?
Short-lived.
Yes. Yes. As you can see, I'm a gym guy. And from January 1st to February 15th, I redo my entire schedule and I go to the gym at nighttime about 10, 11 o'clock at night. Why? Because all the resolutioners are during the main hours. And by the 15th of February, they're all gone. That's because we don't need a resolution when it comes to your health. We need a revolution. Because a resolution isn't cutting it. Why? Because it's not giving you, what in God's name is that shot? What are you doing?
Now she's gonna take her pictures for
Well, come on in.
See?
Shoot, don't be shy.
It's the same thing I said.
There's nothing shy about this group.
I know, especially
Really? Okay, I needed that.
and Joy. Watch out for her.
Which one's Joy? Okay.
We got him on video, so.
If there's anything that you may need, ma'am, whether it's photos or whatever, please just move around.
I just didn't want to interrupt.
No, gosh. So we need revolutions, we don't need resolutions, right? And in order to get revolutions, you have to plan your work and work your plan. If it's not written down, it won't happen. If you get up in the morning and you wing your day, it's like, okay, what am I having for lunch? Was it planned?
No.
If you didn't plan it, then it's not going to be what you want from it. Fair? Fair?
Mm-hmm.
So let's go back to the pyramid. On the bottom is exercise. Exercise. We need to be active. But how long can you live without exercise? Since you are the newly crowned troublemaker in the room. Yes, you can thank Kevin for that because I'm going to pick on you. Right? How long can you live without exercise?
Not at all.
Sure you can. How many of you have never been to the gym?
You be hurting if you don't exercise. If
You can be
lay there.
busy. You can be active.
Oh, yeah.
Right?
Mhm.
My mother and father, I'm not sure I've ever seen them exercise. They were busy. My dad worked a lot, 60 hours a week, but I never saw them exercise. How long can you live without exercise? A lifetime. A lifetime, right? So that's on the bottom of the pyramid. The next step up is food. Yes, food. How long can you live without food? Choi and I kind of always joke, and we said he and I could go about 2 months.
Oh, I could outlast you any day.
Right, right. But we do know that you can go 30 days without food, right? But if it's January 1st and it's your resolution, what are the first two things that you want to do?
Celebrate.
Celebrate. You want to diet and exercise. And I'm going to explain to you how that's putting the cart before the horse. Is there something more important to your body than food?
Water.
Yes, that is the next one up. How often do you have to have fresh, clean, filtered water?
I have 4 of those a day.
We need water every 3 to 5 days. That's the longest that we can go without water, 3 to 5 days. How long? The next one up is sleep. It's about 48 hours. You start getting into that second and third day, you're asking for trouble, right? So it goes exercise, then food, then water, then sleep, then oxygen. How long can you go without oxygen?
Not at all.
Couple minutes.
Minutes. Do you see how this is going up? What is on top?
Breathe.
That's oxygen. What is on more important than oxygen? It's your body's ability to communicate with your body. If you were to look at me and say, where is Tim in this body? I am up here. How do I know that? Because if I lost an arm, would I still be Tim?
Yeah.
Yes. If I had a heart this is a tricky one. If I had a heart transplant, am I still Tim?
Yes.
Yes, because I didn't go with my heart. Right? I am up here. I am that 6 inches between my ears. This is what controls this. How does this control this? Your nervous
Nerves.
system. That is the one thing that your body cannot go without, not even for a fraction of a second. That is why I became a chiropractor. Because if this doesn't communicate with this, this doesn't work. Make sense? That's the hierarchy. So when it's January 1st and we have New Year's resolutions, my stomach goes, "Ugh," because everybody wants to go to diet and exercise. My wife always says, you cannot exercise away a bad diet. Make sense?
Yep.
Yes. Your body is built with a hierarchy or a priority. Respect it. Follow it. It will pay dividends faster than anything you've ever done before. It's not difficult. God made us one way. We can't outsmart what was made. I could probably do another lecture just on the crisis that we're up against now. It's interesting to me. It's interesting. So, this is our office. This is my family. This is Dr. Cindy and I in the top left. We have 5 grandkids. That includes 2 sets of twins. So, these 2 guys here, Jack is going to be 6 in about another few weeks. Joey and Charlie are identical twins, and they're going to be 4 in January. And then Marsden and Melody are 2, and we have 2 more coming in December. They're not twins. We have my daughter and my daughter-in-law are both pregnant at the same time. You have to have a why. Does that make sense, folks? You got to have a reason why you're going to make changes. Right? You know what the biggest motivator for why is? And she touched on it earlier. Pain. Pain will make you get up and do things that you really didn't want to do, but you're just sick and tired of being sick and tired. So I like to say this is my why. Because this is why I don't wear a watch. Because when I wake up in the morning, I'm already focused on, these are my people. And I need to make the world a better place for them. And I make it a better place for them by making it a better place for you. That's why we're here this morning. That's why I pay my staff to be here. That's why I shut down the office to be here. Because if I'm not willing to help you, then I'm into it for this, and that doesn't resonate with me. Right? So this is my oldest daughter, Mandy. She's got the 3 boys. Our son is next. He and his wife have the fraternal twins, the boy and a girl, and she's pregnant again. Our son Joe is a professor at University of Michigan. And then our next daughter is Bria. She's married to a military guy. And in my house, in my world, we love our military. We love our servicemen and women. I will do anything for them. If they come in and say, Doc, I'm in trouble, my only question is, what do you need? I give them anything. Our youngest daughter is just finishing up college. She's a 2-time national champion equestrian. She has a spine that's about 50 years old because she keeps falling off horses. This is my why. I'm going to show you the what to do, but you have to develop the why. And when you develop the why, you write it down. I always have a pin in my shirt because you got to write it down. If you don't plan your work, then you're going to accept whatever comes. This is our team. This is Dr. Holly. She's our nurse practitioner. She has a doctorate's degree as a nurse practitioner. She is certified in geriatrics, which means all of us. That's myself. This is Dr. Matt Riggins. Many of you may know him. He's from the Kingsport area. He practiced here for 30 years. He retired from the system, as he calls it, and now he just hangs out with us. He's a family practice provider. This is Jennifer. Jennifer is our insurance/case manager. So she's the bridge between the insurances and all that stuff and our patients. This is Dr. Cindy. That's my wife. This is Miss Sherry. We call her Mother Sherry because she keeps all of us on one path. She runs our office. Miss Tracy is in the back. She does, doesn't she? Miss Tracy is in the back. Well, we took this picture before she got with us. She is our exercise tech, and Choya is our marketing and sales department. So he's the one that gives us the internet and websites and PowerPoints and all that good stuff.
And smile,
That's-
y'all are all on video.
What's that?
So smile, you're all on video.
Yeah, you're all on candid camera. The thing is, we know what candid camera was. So you're looking for results. We have an integrated medical approach, meaning we have all of these specialties in one building. More importantly, all of these specialties meet every morning to review the patients that are coming in that day. So if you're coming in this afternoon, we've already pulled your chart, we've gone through it. Every team member knows what they need to do to give this patient what they need for that day. If something comes up that's not planned, then I'll knock on Dr. Holly's door, I'll go back and meet with Tracy, and we'll discuss what changes need to be made. So we change that day. We don't put it in a note and send it out, and 2 weeks later someone else gets it, and 2 weeks later it's implemented. That to me is not the way it should be. We do primary care, which is Dr. Holly and Dr. Matt. Physical medicine is me. I look at myself, I put you back together. If you've had joint replacements, if you've got back pain, if you have migraines, if your knees hurt, that's my department. Regenerative medicine goes back to Dr. Holly. Many of you have probably heard of stem cells. Many of you have heard of arthritis. So what we're doing is taking human tissue and rebuilding and regenerating a lot of your arthritic issues. That's what we do. And that's these three things there. So let's get into joints. Joint issues can be from slip and falls. They can be from car wrecks. They can be from athletic events. If you have arthritis, typically you first had an injured joint. She's back.
Do you have a sign-up sheet in here somewhere? Can I just look at it to verify?
Yes, ma'am. Are you going to be signed up on it?
Huh. I'm gonna make sure we have everybody's name.
Wonderful, thank you. Examples. I love to give you examples. If a patient comes in and the x-ray report says arthritis in her neck, that's pretty vague, right? But when I take the x-ray or when I look at the x-ray, the arthritis is only at C5, C6. Nowhere else above. What that tells me is that you were probably in a car wreck or you had a whiplash type of trauma, slip and fall. That part of your spine was damaged and it has then developed arthritis. Do you see the difference? If there's 7 joints in your neck, arthritis just means what? It's wearing out. It doesn't give me any specifics. It doesn't tell me to what degree that we have the arthritis. And it also doesn't tell me how to help you. That's why we do functional x-rays. So if I'm looking at your neck and I take a lateral cervical and I see you have arthritis at C5, C6, What if I did a flexion view and took another picture? And if I did an extension view and took another picture? Wouldn't that maximize that functional component? So now you're loaded and now you're moving. So now the x-rays is telling your story. That's why we all need functional medicine. That is a functional diagnostic position, and it also tells me how to fix you on the functional side. So our primary care with Dr. Holly, she's the only one in our office below 50. You're probably close to
I'm
that.
below 50
You're dancing on that line.
until February. But
We laugh because Dr. Holly's like our daughter. She's about 25 years younger than the rest of us. So she does primary care services, meaning we run our own labs, we do our own EKGs. She's geriatric certified with a doctorate degree. So she handles all of these things. The difference is, what are you going to do about it? If your A1C is high and it looks like you're pre-diabetic, we're going to really sit down with you and talk about what you eat and drink every day. Because we're trying to steer that ship away from medications, right? If we just put you on medications and you continue to live the lifestyle that you're living, we also know where that's going to get us, right? That's the definition of insanity. We have to get away from that. Physical medicine, that's me. We put you back together. It may be with braces. It may be with trigger point injections. It may be with chiropractic. It may be with functional exercise. If you were to think about your day, how often do you pick something up? How often do you pull something towards you? Compare that with how often do you push something away from you? It's about 5 to 1. Lifting and pulling versus pushing. So in our office, when we look at rehabbing you, we're going to rehab you in the way that you live your life. Does that make sense? What doesn't make sense is if you had a knee surgery and we're going to brace it up for 6 weeks. Because what's that knee going to be like when you get out of the brace? You're going to be a hot mess, right? And you have all that scar tissue from the surgery. So now I have to deal with a weak joint, I have to deal with a joint full of scar tissue, and I have to deal with a joint that's post-surgical. That's a hot mess. Why would you do that? As soon as you're done with surgery, we have you moving, we have you stabilizing and strengthening. That way it minimizes the scar tissue and it minimizes the impact of the surgery. Make sense? Spine issues. I have this particular slide in here because I wanted to show you this is cartilage in your knee. And your cartilage loses fluid. The same as the discs in your spine loses fluid. And they kind of get dried out. And when they get dried out, they wear out. They flake up a bit. So this is what it kind of looks like with that cartilage. So when people hear their knees creaking and popping, you ever have that?
Yeah.
I'm saying that because all of us do. So we also do knees, hips. We deal with a lot of hips. And hips are interesting because hips are never a one joint issue. Meaning, if you have right knee issues, I'm guessing, and when I take, your left hip is going to bother you. And then when I look at your back, you've got a right-sided low back, and it goes click, tick, 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 all the way up or all the way down. So if you've been in a car wreck, that starts it, and then it's going to crisscross up or down your entire body. So when we look at rehabbing you or putting you back together, does it make sense to only look at your hip and leave the rest of it alone?
No.
No. But if you're in it for this, yes. Because that knee will be in a year down the road, and that back will be in 2 years. We have to put people first. We have to start doing that. Whenever we do joint injections, we use an ultrasound. That's what this transducer is. The ultrasound guides Dr. Holly as to exactly where the tip of that needle is and so that the injection site is within the capsule or the tissues that's involved. That's why we have that one. So out of all my slides, this is probably the most important one as it pertains to joint health. And this is a typical treatment cycle for joint pain. If your knee hurts, let's use a knee. What's the first thing you do? Over-the-counter meds. Motrin, Aleve, Tylenol. Tylenol is mainly for pain. The other two are NSAIDs. So then we go to NSAIDs, which stands for non-steroidal anti-inflammatory, because it reduces the inflammation in that joint and makes you feel better. And if it goes on long enough and you get increased pain, then you go to your MD and they give you a prescription for NSAIDs. Well, at that time they may take x-rays and they'll say, all right, Joy, you've got some arthritis in there. If you've been taking over-the-counter NSAIDs for over a year, chances are when we take an x-ray you're going to have arthritis. Here's the problem. If I'm laying flat on a table and they take a picture of my x-ray, if they take an x-ray of my knee, what happens to that joint if I'm laying down? It opens up. What happens if I stand up? It loads. When my knees hurt, the first thing I want to do is either sit down or lie down because it unloads the joint. If I'm your provider and I'm taking an x-ray, what type of x-ray best serves me? When you're standing. It sounds so basic, doesn't it? But that's not the way it occurs. So we're going to take x-rays. Your x-rays are going to come back, you have some arthritis, we're going to give you some stronger medications. If this continues, what's the next choice that we look at? Cortisone injections. How many cortisone injections can you have in a joint per year?
3.
Why 3?
Because it breaks down your cartilage and your bones.
Yes. Do you all remember Pac-Man?
Oh, yeah.
Remember that? We're all teenagers. That was probably the first video game, right?
Yeah.
Cortisone, when it's injected into a joint, is Pac-Man. It chews up all the bad stuff and all the good stuff.
Yeah.
That's why you can only have 3 in a year, because it's in there just chewing things up. One of my favorite athletes when we were younger was Bo Jackson. Do you remember Bo?
A little bit.
The kid could do anything. He had speed faster than anybody else. He was a big, thick, muscular kid. He played pro baseball at the same time that he played pro football. I mean, he could do anything. He could do anything at the highest level. Well, when he was in college, he got tackled and they twisted his hip up. So they gave him cortisone injections into his butt. The problem is that every week before a game, they would give him a cortisone injection in his butt. So he didn't have any pain. So as a pro athlete, he was running down the sidelines and he got tackled and his hip broke. Not only did the femur head break, but the entire socket that the femur was in, he had multiple fractures within the socket. Because the cortisone over the years
Broke down the bone.
Made the bone brittle. And it's a shame, because we only got a little glimpse of what he could do. What do you do after cortisone injections? When you keep getting 3 a year, they're not really working, then we're going to get an MRI. We're going to get an MRI. MRI shows you soft tissue, which is cartilage, tendons, ligaments. What do you think that's going to show you? That you have arthritis, that it's being worn, that it's being dried up, it's being brittle. Then you're going to get a knee scope. What happens to the body when it's exposed to oxygen? Example, if someone has exploratory surgery, which with today's technology, I'm always puzzled by that. If you have exploratory surgery and someone is opened up and the oxygen gets to it, if it's cancer, it spreads, doesn't it?
Mm-hmm.
So whenever you have oxygen exposed to tissue, whatever is going on accelerates. So if you have your knee scoped, Whatever is inside is accelerated, meaning the arthritis. And you can only get that knee scoped a couple times because of the arthritis. What's the last thing that you're going to get?
Surgery.
Replacements. How many replacements or how many times can you replace one joint?
Every 20 years.
Why only 2 times?
Because it wears out.
The prosthesis wears out, but when you put a new joint in, you have to resect into the good bone. And you can only resect that twice because you lose good bone to resect. This is the typical treatment cycle of joints. And we have to change that because this isn't working for us. Once you have joint pain, hips or knees, you watch, those folks have about 10 years where they're limited and they're miserable. Anybody have joint issues or joint replacements? About 10 years, I have both knees, and I'm probably going to need to get them replaced in about a year to 2 years. And I'm already past that 10 years where you get up in the morning and you're like, oh, here we go. And you stand up on the side of your bed, you got to shake them legs a little bit, and then you start walking, and the first steps to the bathroom, am I right?
Yeah.
Until things get moving, and then you're in the bathroom and you take a shower, and then you finally get out of the shower and you're like, okay, now I can move. Yes. And then when you get your joint replaced, now you've got about 6 months where it's, I don't have the joint pain, but muscles are extremely tight. There's a lot of muscle issues. There's a lot of issues around the joint. That is our typical process. We have to change that. We have to come up here and we have to start jumping in and doing injections with different types of products to either slow down the degeneration or to rebuild this cartilage. That's where regenerative medicine is coming in. That is what I see happening already, and it's happening more and more. We have to use things like stem cell, but we have to use them up at this level and not wait till we get down here. And I'm one of those patients. So everything that we do at the office, I typically have done to me first. Because if you ask me questions, I need to know. I have a wife, I have 3 daughters, and I've never understood why a woman will go to a male gynecologist. How am I supposed to know what a woman deals with? I can't. Am I going to read books on it? And I would say, you tell me that you're experiencing this, but this book says that you should be fine. Right? Because that's the only reference you and I have. That's not okay. That's not okay. So these are trigger point injections. You ever have that knot in your shoulder where you put your thumb on it and you're like, oh, that's it? We experience that when it comes to physical medicine. It makes her job very difficult because the patient's always tight, they're always guarding. It makes my job very difficult to get the vertebra to move, or joints to move. So what we found is if we do a lidocaine marcaine injection into that trigger point, it relaxes that trigger point and things calm down, and then we can get our work done quick. Non-toxic, no issues. We do a lot of bracing in our office. And bracing to me, what I see is it is done wrong. So many times when we do a brace, they'll put it too high, like a girdle, right? A brace has got to be down here in the middle of your butt. And the middle of that brace has to be right there. And then I only want you to wear that brace when you're doing something strenuous. If you're going to be doing a lot of housework, if you're going to be gardening, if you're going to be walking more than 30 minutes, then you put the brace on. Otherwise, you get used to and accustomed to wearing the brace all the time, and you lose muscle mass. Well, that doesn't do you a bit of good. So we do different bracing for different reasons. But again, when you have all the providers communicating with you daily, things get done faster. So I don't know if any of you are familiar with kinesiotaping. Any of you watch the Olympics? I love Olympic athletes because they're doing it for the love of the sport, not for the money. And you ever see that real bright colored tape that they have on their shoulders or their back? I used to teach kinesiotaping to other doctors. So we do a lot of kinesiotaping at our office. We do a lot of different modalities such as interferential currents. They're like big TENS units. So we're all familiar with a TENS unit. You can hook pads on with a battery and it reduces your pain. Imagine that on steroids. So for instance, the settings here, this goes up to 99. Most patients function in the 20s. So you can imagine if we've got a patient that we run up to 50, 60, 70. So those are some of the treatments that we have. This is a good picture of what functional rehab looks like. We put you in positions that initially you're not very strong and you're not very stable. But after a few weeks, then you start to get stronger and you become stable. This is the type of table that I use. It's very high tech. It uses pneumatic drops. So the drops are based on your weight. So when patients get on the table, we can dial things up, dial things down. It makes it more direct. So these are some of the joints that we've injected, and that's pre and post. And you can see, like on this one, the outside of that left knee, and then you can see the difference here and the changes that we have there. And again, you have to keep in mind, I'm showing you our best cases. I'm not showing you our cases that we had no success with. And there are some of those. There are some. We've had a couple of gentlemen that I can think of that we threw the kitchen sink at them. We rehabbed them, we did chiropractic, we did injections, we did bracing, we did everything. And they still had to get replacements. And that's the thing you have to realize about healthcare. It's not 100%. Nothing is. And here's another example here. My pointer doesn't work on the screen, but you can see on this knee how close and tight that was. And after some time and correct care, we're starting to get some spacing in there. This is regenerative medicine. And I think this is my last one. And you can see the differences between the left and the right. And we're looking at about 1.5 years. It takes time, folks. It takes time. So if patients come in and they're on hypertensive meds, they're pre-diabetic, they need to lose 40 or 50 pounds. Did I not describe a typical American over 40 years old?
Yeah.
Okay, how many years did it take to get them that way?
40.
So when I work with you and I'm talking about taking 3 months or 6 months to get you fixed, please know that 40 years compared to 6 months is quite a drastic change. Do any of you remember there's a TV show in town here called The Biggest Loser? Remember that show? We did a local version of that where we had 5 contestants that we worked with. And the guy that won lost 187 pounds in 9 months. So it is possible. It is possible to make these changes. But it takes dedication, not only on my behalf, but yours. Because it's your body. It's your choice. We now have bioidentical products. Has anybody heard of hormone replacement therapy? We have that. So we took 1.5 years and we researched all the different products, all the different methods, from creams to orals to injections to pellets. We looked at all of them and we chose what we felt was the best company doing the products the best way. And bioidentical means that the hormones that we're using, they're identically matched to the hormones that are in your body. So all of us are familiar with the word steroids, right?
Yeah.
And don't we all have a negative connotation with them?
Yeah.
In other words, they're harmful,
Yeah.
especially when you take a lot of them. That's because it's not a match to what your body has. You're putting a foreign substance into your body and your body's fighting it. So with bioidenticals, we can use hormones that match to your body, and then we do blood tests on a regular basis or labs to make sure that you're getting the correct dosage. And you want to talk about a game changer. Choya, would you like to address the game changer of bioidenticals?
Sure. Well, let's see. It's only been about 2 months, hasn't it?
Yes.
Okay, so up to about 2 months ago, I'm 49, I'll be 50 in February, so I'm still part of the juvenile crowd at Advocate.
Really?
So they keep a few of us young ones around, just to remind me. So. Anyways, I could never sleep. I would literally be up all night, couldn't go to sleep. If I did fall asleep, it was for an hour or two. Then I'm back up again, can't go to sleep. My brain's always going 100 miles an hour. And so I'd have a lot, that caused health issues, obviously. They talked to me about the hormone replacement therapy, so I finally agreed to do it. Within about 4 or 5 days, I did something revolutionary. I slept 8 hours. Now that sounds like, okay, wow, you slept 8 hours, congratulations. Were you awake during the day, did you sleep at night? Sounds normal to most people. I can't remember the last time I slept 8 hours in my life, literally. Even as a kid, I never slept 8 hours. So that was kind of weird for me. And the next night, I slept 13 hours. And I woke up, and my wife's like, do you know what day it is? And I'm like, what? She's like, I'm just messing with you. Come in for lunch. So that was pretty crazy. And ever since then, I've been sleeping 7 to 9 hours a night like clockwork. I have no trouble going to sleep. Get up just fine in the morning, ready to go. What that has changed for me is amazing. I have so much more mental clarity. It's like going from one station on the TV to four screens with 3 browsers open and 18 tabs. 4 of them are playing music. I know all 4, which one they are. I can just concentrate on so many more things. It's crazy. I feel better. My resting pain level went down from constant 3, 4 down to almost 0 to 1 at best. The 1 is that nasty muscle in my scapula that never likes to give up because I'm always doing this all day long. But Tim helps with that a lot with his chiropractic adjustments, and not only does Dr. Tim help me, Dr. Holly's helped me with trigger point, a couple trigger point injections, and now I can actually move my shoulder. You probably remember when it was about like this, and that's about what I could do with it at times. So it's just been, the sleep has been amazing. It's life-changing. I'm much more chatty, that they regret. My sense of humor has gotten a lot sharper. Now cuts coming and going.
Energy levels?
All of it. I have all the energy, but it's not, I had a lot of energy before, but it wasn't coherent.
Right.
It's like it went from a really wide flashlight to a laser. I can just focus so much more, and I feel better, and I don't know, everything just seems to work better. You can draw your own conclusions on that, but everything works better. So it's been pretty awesome.
Our goal is to restore normal.
And I never knew what normal was. I like it.
And most of us don't know what normal is because you've slipped over the years. And then when you recognize that you slipped, then you start saying to yourself, it's because I'm 49. It's because I'm 59. It's because I'm 69. Everybody does at this age. Well, they might, but you don't have to. You have a choice.
I feel 20 years younger. In fact, I feel better because I wasn't sleeping then either. So, I mean, some days I feel like a kid again. My wife's like, slow down.
Yeah. So
And she's younger than me.
my focus in guiding this office is to add services or products that make your quality of life better. Example, we just added orthotics. You stand on a scanner and it scans your feet and it videotapes you, and then we send it off to the company and they build inserts for your shoes. He and I, we're on our feet 10, 12 hours a day.
I couldn't survive without my inserts.
It's an important piece. So for me, anything that makes my quality of life better, hormone replacement therapy, I get pellets. It makes me function better. It makes me work better. My feet don't hurt anymore. Anything that makes my life better, why aren't we adding it? So the end goal of our facility is to have a facility that if you want to live life to your fullest, then this is where you come. We teach you about exercise. We teach you about nutrition. We teach you about lifestyle. When you look at healthcare, 85% of healthcare is chronic disease. Chronic disease means it builds up over time. Here's a question for you, sir. Can you cure a chronic disease? The answer is no, because your lifestyle is what created it. But what you can do with chronic disease is reverse it by your lifestyle. We call this epigenetics. 10% of healthcare is acute. Slip, fall, break something, that's acute. Car wrecks, that's acute. 3 to 5% is genetics. Remember that picture I showed you with all my grandkids? My oldest twin grandsons, they have a genetic condition called CAH, congenital adrenal hyperplasia, meaning their body does not produce cortisol, and cortisol is a hormone. We figured this out because at 6 days old, they were getting snotty, and we were holding them, and they were responding, and then they went limp and didn't know what was going on. We had to call 911. They ended up life flighting them 3 hours away. So now they have 4 times a day, we have to give them liquid oral medication, hydrocortisone, because their body doesn't produce it. If they have a stressful situation, like they're sick or they're injured, we have to inject them. So what I'm looking at doing is using stem cell and possibly doing what we can to help these boys. You've got to think outside of the box. If we don't think outside of the box, and if we don't start doing things different, that's called insanity. I can't tolerate that. If something, for instance, back surgeries. How many of you have heard people with back surgeries? Yep, everybody goes. Do you know what the success rate is of back surgery? 1 in 5. 20%. 20%. How do you quantify a successful back surgery? That was my next question. If you walk in the door and your pain level is an 8, and when you leave the hospital it's a 7, they quantify that as a success. If your pain levels are reduced, if they're reduced even by 1, that's a successful surgery. Now let's go back to the beginning. 80% are not considered a success. So what should be your next statement? We got to do something different. If 8 out of 10 is a failure, then we got to do something different. And it's not. That has to change, right? Because who pays the price? We as consumers. We use stem cell for a lot of different things. In our office, we primarily use it for joints and joint injections. So when you see like women getting Botox, which is botulism, right? That's what Botox is. How about stem cells? How about regenerate those wrinkles and those lines? How about repair? That's what that can be used for. So this is what I always use to conclude all of my seminars. I've been with my wife since I was 15 years old. 15. And we had 4 kids together, we went through medical school together, we've run the gauntlet. And I've always said, I want to be 85 years old, and I want to be walking down the beach like at Hilton Head, holding her hand, saying, honey, that was one hell of a run. Because if you can get 70 years with somebody, it's unseen, it's unheard of. You have all of our information, you have all of our packets. If there's anything that we can ever do, please call us. Please call us. Text us. Send us something. If you just want to chat, and how many doctors are willing just to pick up the phone and chat with you? That's what we do. Because we have to be different. Otherwise, it's insanity. Does anyone have any questions for me?
What do you think about the injection of Prolia for the bone?
It has some.
Osteoporosis.
I like to take a different approach. Our lifestyles is what has created the majority of osteoporosis. okay? Meaning, I would prefer to change how I eat and to change my exercise to build up my bone density. And if I still had bone densities, I would rather look at taking vitamin D3 as an oral supplement or taking vitamin D3 as an injection. Anytime that it is anything outside of that, there's negative side effects. And in my mind, you need to minimize the amount of negative side effects that you know of, because there's a ton of negative side effects that you don't know of. Fair enough? So I would look at dark green leafy vegetables are very good for vitamin D absorption. Get out in the sun, or if it's wintertime, get on like just a tank top or just your underwear and get out in the sunlight, even if it's in your house. You gotta be exposed to vitamin D, right? So let me ask you something, and I'm not gonna go on a tangent, I promise. When are we typically sick in the United States? What time of year? Winter. There is a direct correlation to your vitamin D levels and your immune system. It's in the wintertime that your vitamin D levels drop, and it's during that time when you're susceptible to things like viruses. You never have a virus outbreak in the summer. Historically, look it up. It doesn't happen.
That is another thing I want to ask you. Why in this area, people said you can hardly get enough vitamin D in the wintertime, in this particular area?
I would answer that it's occurring everywhere, because our food supply becomes more and more processed.
Yeah.
Why is it that the meats and the vegetables are on the outside of the store aisles?
To get you shop in the
In
middle.
the middle, which all the processed stuff is.
Right.
Fair enough? So when it comes to vitamin D, you gotta get in the sun. You gotta get your clothes off to the point where you can get exposure to the sun. It's important and you need that. But then on the other side, what you eat is vital. In our office, we like to do labs every 3 to 6 months. I just had my vitamin D levels done and I was at 37. Normal is 30 to 100. So my response is I am cranking up my vitamin D, my supplements.
How much unit do you take for vitamin D in a day?
Since I'm at 37, I need to get above 70. So I've been taking 20,000 IUs a day, which is really high, right? Yeah. But if I do that for a month, I'm going to get that rascal back up to 80, 90 where it needs to be.
And if your stress level is up, you need more vitamin D.
Yes, but then we get into, especially when it pertains to illness and viruses, zinc, D3, vitamin C, those are just rock solid stuff,
Yeah.
right?
Yeah.
So when you get your labs done and you look at your vitamin D and normal is 30 to 100 and it says, well, Joe, you're normal. I'm not interested in normal,
Nope.
right?
Right.
Your body is two things for you. Your body is your vehicle to get through life. Do you understand that?
Yeah.
It's your vehicle to get through life, and it's your history book. All the good things you've done and all the bad things you've done. And my job is to read your book and then put you on a different path to take you from a little Chevy Chevette and try to get you to be a Corvette. I need to take you from something that's small and economical, and I need to get your body to where it performs. That takes discipline, and it takes work.
Well, a lot of times you did all of those, but it's inherited. You have that, so that is my question. You did all that, all that healthy lifestyle, exercise, everything, but it's inherited. It is
Yes.
It passed down generations. Your bone, your bone structure, with your whole body.
Yes. So, in my opinion, ma'am, we need to start with the things that we can control. right?
That,
So-
that was the reason I asked you about Prolia, because that is very new,
Mhm.
new, I guess, develop of, increase the bone density
Yes.
injection.
So we always start with things that we can control, and we give timelines, right? So, you're gonna take 3 months and you're gonna eat clean. You're pretty much gonna be a vegetarian, right? Dark green leafy vegetables, you're gonna eat a lot of good meats. And you're also gonna be going to the gym 3 days a week and you're gonna be lifting weights. That's gonna increase your bone density. Depending on what your labs are, then we're gonna do injectable vitamin D once a week to start, to get it back up. And then we're gonna do some oral supplementation once it's up. Now, that's lifestyle. And you heard me talk about epigenetics. Epigenetics states that your lifestyle turns on and turns off your genetic expression. So you may have a genetic expression for low bone density, but your lifestyle is turning it on, turning it off. And that's why we always start with lifestyle, and then from there, we allow so many months. 3 months to 6 months is typical. At the end of 6 months, then we see where you're at, and we may need to take some more drastic measures. Usually, if it's somewhat of a new drug, I'm not a big fan of anything new. I like things that are old and proven.
I've heard that probably could cause hip fractures.
That is a double-edged sword, because usually it's the decreased bone density that's giving. So for instance, you know how they say that people fall and break their hip? It's backwards. People step wrong, the stress goes into the joint fractures, then they fall.
My orthopedic told me it was the angle I fell.
Usually it's the step, the stress, and then it cracks, and then you go. So we have to be very careful when it comes to the word genetics. I was raised by my parents. They were both married their entire lives. The first 20 years, I lived their lifestyle because I was in their roof, right? When I was 15, though, I started to go down a different path. My mom smoked 2 packs a day. My dad was a light smoker, drank a lot. I started into bodybuilding. I got away from any pollutants that was going into my body. I didn't drink. I didn't get near cigarettes. I started a different lifestyle. Even today, I have a sister that's 4 years older than me that still had my parents' lifestyle. And if her and I were to be side by side, we look about 20 years difference. So we have to first do and control what you can control. But you have to put a timeline to it. 3 months to 6 months is a reasonable timeline. And that holds you accountable to do the things that you need to do. So when we talk about exercise, if you and I go out for a walk every night and we're walking this fast and we walk 2 miles, this to me is keeping busy. This isn't exercise. I'm just moving. This isn't exercise. Now, if you and I are saying from here to that stop sign, we're going to walk, but we're going to walk as fast as we can. That means your heart's going to be pumping and you're going to be sweating. That's exercise. See what I'm saying?
Yes.
When I go to the gym here in an hour, the younger generation makes my hair white. I'm working on tolerance. I'm working on it. I go into the gym and they're tying up a machine and they'll do an exercise and then they'll pull out their phone for like 8 or 10 minutes.
Oh.
And I just about lose my noggin. Move. Get your work done. So when people talk about exercise, you only need to exercise 20 minutes 4 times a week. So if people say, I just don't have time, tell me you don't have, give me 10 minutes 3 times a week. I don't even have that.
So how long have you been in Johnson City and
10 years,
how long has it been Advocate in Integrated Medicine?
3 years. When my wife and I got out of school, we're from the Detroit area. We went down to Toledo, and for the first 10 years of our career, we were in these types of practices. That's how we were trained. In Michigan, I'm not allowed to own this type of corporation. So when we decided that we wanted to do this model, and the reason that we chose to do this model is because it gets people healthy. It gets you healthy. If you want to be healthy, then let's do it. But when you work with Tracy, after about the first 3 or 4 weeks, you're going to be looking for the door because she has you working.
I have you sweating.
You know,
When you
we're
leave, you
we're
sweat.
in there to do a job, right? And you're coming to see me to get results. Well, we're going to get results one way or the other. You know, we're here to get things done. And usually after about a month, patients are like, you know, I'm feeling really good. I don't have pain. And what does that tell you? We've reduced it from a 70 or 80% down to 60%, 55%. Your body's only functioning at halfway. And you're telling me that you're good with that. Knowing that in the next 6 months, you're going to be walking back in the door and saying, Doc, it's back. And we're going to chuckle and say, it never left. It never left. Any more questions I can answer? Ma'am, I know that probably wasn't as direct as you would like it to be.
That's the thing.
Now, I
You-
took
you-
that shot,
Yeah,
took the first injection
Wow.
in June, I think it was.
Yeah, my question is, anybody know what's the long-time effect on the bone? Really?
no we don't.
See, that's the problem.
But yes,
That is a problem.
but do you all remember a medication called Vioxx?
Yes.
Yeah,
It was a prescription. Do you know Vioxx had 650,000 deaths directly attributed to it?
Mhm.
650,000,
That sounds like the number of COVID deaths.
right? And they went and pulled it for 6 months, relabeled it, and put it right back out there. So when it comes to new products, I am very conservative on that. I always want to choose the path that I'm sure of, and that's my lifestyle. I control what I eat, I control what I drink, those types of things.
Well, I've got a lot of other health problems, so that was the least thing that they wanted me to take was that.
Sure,
Because I've got liver cancer, I've had it, and then arthritis and
you betcha, you
hip
betcha.
joint replacement.
Yeah, so we just simply start, the way that we go about this is the first thing you control is what you drink. You control what you drink. And then once you have that mastered, then we move on to breakfast. And once breakfast is mastered, then you move on to lunch, then dinner, then snacks. And usually, surprisingly, that takes me 3 months to get you to master what you eat. 3 months. And then we start to introduce exercise. And that's where the revolution is versus the resolution.
you know, I think that's all goes back to have a good habit, to have a good
Yes,
habit
ma'am.
of living since you were born.
Yes.
The parents needs to take tremendous responsibility of
And-
what they give the kids.
Yes.
And that, I think we need to change that instead of, come, or you go into whatever, and now we're gonna come back to purity.
So,
This is
we
ridiculous.
need to-
waste all that money and time. Parents needs to be more responsible.
Mhm. We were part of a study back in '99 through '06 in Chicago, Illinois, where they took chiropractors with advanced residencies like myself, and we were primary care doctors. And whatever we ordered, they paid for. And this model that is now my office, that's where it came from, our 7-year study. We were able to reduce healthcare costs by 59% per year for 7 years. I presented it to Blue Cross Blue Shield of Michigan, the medical director, and their response was this: "Thank you for taking the time, Dr. Dunne. We appreciate your depth of knowledge on these different topics. Unfortunately, we offer all of these pieces that you say cause the reduction in healthcare costs, and we only saw an 11% reduction. Therefore, we don't think your study is accurate." They allowed me a rebuttal time. And I stood up, thanked them for taking the time, and I said, ladies and gentlemen, when I was in medical school, I owned a valet company, parking cars. One of my favorite cars is a Ferrari because it's hand-built. Every piece on that Ferrari is hand-built and hand-assembled by one team of individuals. They take more pride in that car than you ever will because it's their baby. Here's the difference. You say you have all the pieces to the study that I have. The difference is you have a Ferrari. Your Ferrari is in pieces all across the gymnasium floor. My Ferrari, I assembled it, I test it, I drive it, and I incentivize it every day.
Yeah.
That's the difference.
They suggest that you do the things that you're doing.
Yes, I assembled it, I tune it, I drive it, and I incentivize it every single day. And that's exactly what you're talking about, man. What we need to do is incentivize people to do the right thing. So how do you incentivize healthcare, right? The way that we came up back then, we had 12 points of interest, which were things like exercise, blood glucose levels, BMI, lung capacity, lung tidal volume, all these different measuring points. And every 3 months you got tested on all 12 points. For every 2 points, you were given something. Sometimes it was a day off work. Sometimes it was $100. But if you got 10 out of the 12, you got an extra $1,200 and 3 days off work. And that was every 3 months. So that means every 3 months, you and your spouse could take a long weekend with an extra $1,200 and go have fun. If you incentivize those things that make people healthy, people will do it. If you counter-incentivize, if you make healthy food more expensive, if you make going to the gym costly, if you counter-incentivize, then we get what we have today. If you have to give away something, and if you have to threaten, and if you have to mandate that someone does something, we as Americans need to step back and go, wait a minute, you're threatening me if I don't do what you're telling me to do? Is that good for me? We have to question. And as long as you have the ability to make your choice on your health, I'm all for it, whatever you decide. But it needs to be your choice. It's your life.
On your statement about parents taking responsibility, I don't think what a lot of people realize that your health actually starts at conception
Yeah, that's
and is
another-
prenatal.
We did that for a while back in Toledo where we took families that were having difficulty conceiving, and for 6 months, the women maintained their birth control, but for 6 months we got the man and the woman healthy. They were exercising, eating clean, they had an alarm to go to bed, they had an alarm to get up, they were meditating, they were doing all of these things, and they physically got healthy during that 6-month time. And with every one of them, their difficulty conceiving was gone. Incentivize those things that are right. Any more questions before we wrap up? I appreciate you all coming out. If you do have any questions, concerns, or thoughts, you have our information. Please call us. We're here for you. And I will hopefully see you all next time.
Thank you.
You're welcome.